Good morning, students. Today I will be telling you about cancer. Cancer is an uncontrolled growth and proliferation of cells of the body. The cancerous cells divide repeatedly and endlessly by mitotic divisions. The word cancer does not refer to a single disease, but it refers to a number of changes or malfunctions of the body cells. These cells develop mainly due to transformation of normal cells in which the normal process of growth is changed. Now, how do cancer cells differ from normal cells? Cell division in normal cells is a highly regulated process. There is a balance between the formation of new cells and cell deaths in most tissues and organs. Normal cells show a property of contact inhibition, so contact with other cells inhibits further cell divisions. But in cancer, the cells suddenly start multiplying in an uncontrollable fashion and do not respond to the normal growth mechanisms as there is breakdown of these regulatory mechanisms. Then in normal cell division, the mature and differentiated cells have a finite lifespan. Old and worn out cells are replaced by new cells formed by cell division and differentiation. New cells are produced, and this production of new cells is regulated in a manner that the number of given cell type remains nearly constant at any given time. But the cancerous cells proliferate in an unregulated manner and give rise to clones of cells that expand and finally give rise to tumors. Now, what is a tumor? A tumor is formed by an abnormal mass of tissue that regulates when cell divides more than they should. They then increase in size and they disrupt the normal cells. A tumor may or may not be cancerous. So we say tumors are of two kinds. One kind is called benign tumors that are not cancerous, and the other kind of tumors are called malignant tumors which are cancerous in nature. The benign tumors are enclosed in connective tissue, whereas the malignant tumors are not enclosed in any specific tissue. The benign tumors remain confined to the site from where they have originated to the site of their origin, whereas the malignant tumors are not confined to the origin of the tissue, to the tumor, to the site where the tissue has multiplied in an unregulated manner. The benign tumors may grow in size, but they do not spread to other parts of the body. The cancerous tumors, they are carried by the blood. The cells of these cancerous tumors are carried by blood or lymph to other parts, and then they spread secondary cancers or metastasis. A benign tumor may turn malignant, and that is the reason they are removed as soon as they are discovered. The cancerous cells grow rapidly and they start killing the other cells, and the spread of secondary tumors is fatal. Only malignant tumors are true cancers. Then we come to the next topic, causes of cancer. Cancer is neither hereditary nor a contagious disease. Gene mutations or abnormalities in the chromosomes or cytoplasm result in cancer. The agents that produce cancer are known as carcinogens, like the radiations, chemicals, and sometimes certain viruses. Main causes of cancer are, firstly, overexposure to ionizing radiations like the X-rays, the ultraviolet rays, and the gamma rays. Then number 2, chemicals like nicotine, caffeine, steroids, and sometimes air pollutants may cause cancer. Third point, cause of cancer, irritation of buccal epithelium by chewing betel leaves or tobacco, or irritation to the lung epithelium by smoking may cause cancer of mouth and lung respectively. Various types of viruses called oncogenic viruses have genes which are called viral oncogenes, and they have been said to be associated with cancer. Several genes called proto-oncogenes have been identified in the normal cells, which on activation under certain conditions can lead to cancers. Then the signs and symptoms of cancer. The local symptoms are unusual lumps or swelling, bleeding, pain or ulceration. Symptoms of metastasis, that is the cancer that has spread from the original site to other locations in the body, enlarged lymph nodes, cough, enlarged liver, bone pain, and advanced cancer may cause pain, which is usually not the first symptom. Then there can be systemic symptoms like weight loss, poor appetite, excessive sweating, anemia, specific conditions due to active cancer. Now, cancer can be diagnosed, or diagnosis of cancer can be done either by biopsy or by various kinds of imaging techniques like MRI, CT scan, etc. So, biopsy means the histological examination of the suspected cells or the tissues by a pathologist. Tissue for biopsy for the test is obtained by surgery. Then the next method of diagnosis can be imaging techniques, radiography, CT scan. CT stands for computed tomography, MRI, that is magnetic resonance imaging. These are useful methods to detect cancers of internal organs. They can give more precise information about the location of tumors in the body. So these methods are used to diagnose cancer. Then we come to treatment of cancer. Cancer can be treated by surgery, by chemotherapy, by radiation therapy, by immunotherapy, or by monoclonal antibody therapy. The choice of therapy depends upon the location and the grade of the tumor, the stage of the disease, and the physical condition of the patient. Complete removal of the cancer without damage to the rest of the body is the ultimate goal of treatment. Surgery, it is the removal of the cancerous cells surgically and has only limited usefulness. It is most effective in breast cancer or in uterine cancer. Surgery does not ensure that all cancer cells have been removed. Also, not all tumors are accessible for surgical manipulations. Then, radiotherapy. The basic principle here is to bombard the cancer cells with rays that damage or destroy the cancer cells but cause minimum damage to the surrounding normal tissues. However, this approach does not cause damage to tissues but damage to the tissues in the vicinity of the cancerous cells. We can use chemotherapy for treatment. A variety of anti-cancer drugs that can destroy the cancer cells are used. These drugs interfere with cell division in different ways. Most forms of chemotherapy target all rapidly dividing cells, and they are not very specific to the cancer cells only. Hence, chemotherapy has the potential to harm healthy tissue. Chemotherapy may lead to hair loss or anemia, and both these things get corrected only after the treatment is stopped. Then immunotherapy can be used. Immunotherapy means monoclonal antibody therapy. Immunotherapy is the use of immune mechanisms against tumors. The agents are monoclonal antibodies which are directed against the proteins that are characteristic to the cells of the cancer, or cytokines that modulate the immune system's response. The patients are given substances called biological response modifiers such as interferons to activate the immune system and help to destroy tumors. Then hormonal suppression. The growth of some cancers can be inhibited by providing or blocking certain hormones in certain types of breast and prostate cancers. Removing or blocking estrogen or testosterone is often an important additional treatment. So this, what I read to you just now, was what is cancer, how do the cancer cells differ from the normal cells, what are the symptoms of cancer, how is it diagnosed, and what are the different kinds of treatment that can be given to cancer patients. That is all. It was a small topic. I read the important details for you. I will be putting up a PDF of my notes so that you can go through it and make your own notes. That's all. Thank you. Take care.